Good morning. I'd like to welcome everyone to the fourth in our series of 8 webinars for National Radon Action Month. My name is Sarah Kirby. I'm at NC State University and I work with NC State Cooperative Extension. I'm also a housing specialist here, and our job today is really to be the technical host of this webinar series. This has been a wonderful, I think, opportunity to learn more about radon, all aspects from health to location to research that's going on in this area. But I want to turn the presentation over to Philip Gibson, who is a radon specialist with the NC Radon program here at in North Carolina. And so I'll turn it over to you, and he's the brainchild behind all of this. So Philip, take it away.
Thank you, Dr. Kirby. Before I go into introductions, I want to note to everyone that in the chat box, and I think Sarah, correct me if I'm wrong, in the chat box are where you can find, or is where you can find the documents that I've uploaded that are connected to this presentation and to radon in general. Specifically, you may want to look at the radionuclides radiological fact sheet, and then the final report of the North Carolina Radon and Well Water report that came out a number of years ago. But also, Dr. Kirby, I want to thank you once again for making this webinar possible by sharing your time, your expertise in the technology of North Carolina State University. To everyone who's joining, thank you for your participation. This session is being recorded, and like the others, we'll have closed captioning added to it and then made available. And I will email you a link to access that, but later they will be on our website at ncradon.org. I also want to acknowledge the support that we've had in reaching various audiences for this and the webinars that have been conducted. The organizations that partnered with us to market these events are represented in this slide that Dr. Kirby is sharing. So our speaker today, which I'm really excited, I've heard Evan speak on a number of occasions, and I'm learning something every time I hear him present. But our speaker today is Evan Kane. Evan manages the groundwater management section of the Department of Environmental Services for Wake County in North Carolina. He oversees Wake County's programs for permitting and inspection of private drinking wells or drinking water wells, and programs for outreach, testing, and technical assistance for private well users. And prior to joining Wake County's Department of Environmental Services, Evan worked for the North Carolina Division of Water Quality for 14 years, developing and implementing programs for groundwater protection and groundwater monitoring. He has also worked for the North Carolina Geological Survey, mapping the geology of the western coastal plain and eastern Piedmont of North Carolina. He's also worked for a private environmental consulting firm assessing groundwater contamination at manufacturing sites. And Evan has his degrees, his bachelor's and his master's degree as a North Carolina licensed geologist in geology from North Carolina State University. So I would like you to join me in welcoming Evan Kane.
Okay, everything good?
Everything's great.
Okay, great. So I've entitled this talk Radionuclides in Private Wells. I probably should have subtitled it One County's Experience. Wake County Department of Environmental Services is a component of the local health department for Wake County, North Carolina. We have some interesting programs going on related to private drinking water wells. So we want to share our experience here with radionuclides in private wells. This really builds on several years of studies and work by others in North Carolina, but also other states' experiences with this issue have really informed our approach to this. Just a little bit of background about Wake County, North Carolina. We are, let's see if I get my mouse back here. Okay.
Evan, can I
Yes.
stop you just for a second? I don't believe your screen is sharing.
Okay, sorry. Okay. We want to do this one. Is that better?
Perfect.
Thank you. Okay. So just a bit of background for those not familiar with it. Wake County, North Carolina is the capital county, sorry, it's host to the capital of North Carolina. Oh, okay. The total population of the county is just over 1 million. We're rapidly growing, adding about 56 new residents per day. You've probably heard of the Research Triangle Park and would think of this part of North Carolina as being very modern. And we are in many respects, but we also have a fairly high reliance on private drinking water wells. Public water supplies, either run by municipalities or investor-owned utilities, serve about 85% of the residents of Wake County. The remaining 15% are served by private drinking water wells. So these are wells that are not covered by the Safe Drinking Water Act. There is no requirement for a qualified operator and responsible charge. Within North Carolina, we actually have a pretty proactive private drinking water well program that requires permitting and inspections of private drinking water wells when they are installed, and requires a certain amount of testing at the time that they're installed. But after those initial approvals, the well owner is responsible for the ongoing maintenance and testing of the water supply, which you can imagine creates some challenges because it's John Q. homeowner who is running that water supply and may not always understand what risks are out there in that drinking water. The 150,000 residents are served, who rely on private wells, are served by about 40,000 wells countywide, many of which predate our permitting program. And we are still installing about 400 new wells annually in Wake County to serve new development, replacement wells, et cetera. So in order to help those well owners with their responsibilities for maintaining their water supplies, we've been running a pretty active technical assistance program for several years. We offer pretty comprehensive well water testing services through our own in-house lab as well as a contract laboratory. And we've been trying to help people anticipate what their problems might be and get the proper testing for those things. As we began reviewing several years worth of data collected from our technical assistance program, we were a little bit surprised by the results. This chart just represents the percent of samples that we've pulled that exceeded EPA drinking water standards in an initial test from a private well. And some of the usual suspects like nitrate and fluoride, you can see here, we have just 1 or 2% of the samples exceed the drinking water standards for those. Also, man-made chemicals like pesticide dieldrin or chlorinated solvent trichloroethylene exceed drinking water standards in a very small number of wells. Obviously, it's a concern for those individual cases, but what we found was that uranium, and it's essentially a proxy of uranium, gross alpha activity, standards are exceeded in 10 to 20% of the samples that we pulled over roughly a 5-year period. That makes these the most common contaminants of health concern to exceed drinking water standards in the county, and actually fits with a national trend. There was a paper from the USGS, DeSimone and others back in 2009 that looked at about 2 decades worth of testing of domestic wells nationwide and found that naturally occurring contaminants were the most common ones to occur above health-based standards in wells nationally. So in our case, it happens to be uranium and some other radionuclides, but if you go to other counties with different geology, you would see maybe arsenic is the most common issue. So kind of fitting with a national pattern. We had some reason to suspect that these were naturally occurring issues, but just to be sure, we did overlay our well testing data on detailed geologic map of the county. Detailed mapping was fairly recently done by the North Carolina Geological Survey, and we're able to determine that a particular geologic formation and some nearby rocks that have been impacted by that formation contain most of the exceedances. That formation in particular is the Rollsville granite. It is a Pennsylvanian aged granite, which also has a lot of intrusions of granite into the surrounding rocks, and seems like the logical culprit here. So initially we did a study on uranium occurrence in wells over about a 5-year period. And as we began learning more and more about the uranium issue in well water, one of the first things that became clear was that this is not limited to uranium, but uranium is just the start of the decay chain. And so there will be multiple radionuclides present in the groundwater in an area where the rock is naturally enriched in uranium. Primarily from a drinking water perspective and human health perspective from well water, we are looking at 3 main elements: uranium, radon, and 2 isotopes of radium. The radon health risks, I think, are pretty well known to people, but just to recap, with uranium, the drinking water standard is actually set based on uranium's behavior as a heavy metal and the risk of kidney toxicity. But there is also radioactivity from the uranium, which can cause an increased risk of cancer. Radium-226 and 228, obviously the exposure to those creates an increased risk of cancers, primarily bone cancer. And radon in water is a little bit different animal in that there's 2 routes of exposure, one being the radon that off-gases into the home and especially exposes people in the bathroom during showering, and poses an increased risk of lung cancer from inhalation. But then there is also increased risk of stomach cancer from ingestion. There is not a drinking water standard for radon in water. The EPA looked at this several years ago for an extended period of time and ultimately has not established a drinking water standard because of a number of factors, the vagaries of how people are exposed, and so forth. There is an NRC report on radon in water, and then within North Carolina, we had an interagency committee on radon in water to develop an advisory report back in 2011. In that advisory report, they established 2 thresholds for people to consider treatment of radon in their drinking water. The higher of those is 10,000 picocuries per liter in water, and the lower being 4,000 picocuries per liter. Philip has mentioned the fact sheet that explains what those 2 thresholds mean. But one of the key findings in that Radon in Water Advisory Committee report was that when you look at radon in water, you need to also make sure you're assessing radon in the indoor air overall so that you're attacking the right source of radon. So taking all this information into account, in 2016, we began publishing a testing recommendation for private well users within the county that covered the eastern half of the county where the rock types we felt were more prone to these types of contaminants. and we developed a specific test recommendation, which for the ease of the private well user, we just termed the RADS package. That's gone through a little bit of evolution, but at present, that RADS package that we recommend for private well users in the eastern half of the county includes a test for uranium, a test of gross alpha activity, as well as gross beta activity, a test of radon in water, and when we're doing the testing, we also drop off a test kit for radon in air. And whether you go through the county and our testing services or go out to a commercial laboratory, this is the recommendation that we have for well users in the eastern part of the county. And in particular, it's easy for people to forget the fourth test there of radon in the indoor air. In addition, we began a rule revision process of our local rules that govern the permitting and approval of new private drinking water wells. And beginning in March of last year, we have added a new testing requirement for all new wells or wells serving new construction, that those wells must be tested for gross alpha and beta activity. Ultimately, we opted not to include the radon test as a requirement here. We can get into more of that in the discussion, but the lack of a drinking water standard and the lack of a regulatory program that requires radon resistant construction to protect from soil vapor issues were underlying the decision not to include radon testing as a requirement for new wells. So we did these things. We feel like these were pretty good steps in the right direction to protect the health of private well users. But as we then sort of looked back at a program review, looking at that exceedance rate that we're seeing for uranium and for radon of 10 to 20% of the wells in the county, and multiplying that times the 40,000 wells we have in the county, this is what the scope of the problem looks like. This is the pie chart may imply a level of precision here that is not real, but consider this as a cartoon where we have roughly 40,000 wells in the county, and maybe 6,000 of those are currently contaminated with uranium or other radionuclides. We, at this point in 2018, had tested about 800 wells for any radionuclides at all, and confirmed roughly 160 contaminated wells through that testing. So we're still looking at several thousand wells in 2018 that were likely contaminated, and the users of those wells probably did not know it. We also see, just because the geology does not stop at the county line, that the scope of this problem is not limited to Wake County, but also impacts our neighboring counties, especially Franklin County to the north of us, which has the same Rollsville granite and another granitic pluton underlying much of the county, and similar plutons in other counties of the eastern Piedmont. And if we go west, we would see others as well. And in fact, looking statewide, there was some great work done by Ted Campbell with the North Carolina Division of Water Resources, along with Phil Bradley with the North Carolina Geological Survey, and Kyle Messier, who was then a graduate student at UNC, to assess the susceptibility of private wells to elevated radon throughout North Carolina. And we can see here the purple area and the sort of orange or brown area in Wake County in the center of the map is essentially our area where we're recommending or requiring certain tests for radionuclides. And these colors and patterns extend into other areas throughout the state. So again, looking at that scope where we have several thousand wells that are likely currently contaminated, and the well users are likely unaware of this issue, we began to think that as a county health department, we had some obligation to improve the awareness of this issue in the private well community. and get more people to test and try to help them through things. So as we looked at how we respond to this issue and get the word out, we considered 3 key questions. 1, what is our obligation as the health department? What is our capacity? And what's the likely impact on other agencies and jurisdictions? To consider those questions, we consulted with a large number of groups within Wake County government, within Wake County private sector, but also at the state level, and consulted with other states on how they've approached this type of an issue. I won't go through everything here, but through all of those folks, we, and the consultation with those stakeholders, we arrived at a few conclusions. One was that we had an obligation to notify the public. And through that, we needed to make sure that our message was accessible to everyone and that resources were available to everyone that wanted to make use of those resources. Also, looking at the capacity, we realized we do not have the capacity. If we were to do a very large-scale outreach campaign, it would likely overwhelm our current capacity. In a given year, we typically will collect water samples from about 400 or 500 wells. And if we were looking at trying to get thousands of people to test their wells, that would easily overwhelm our current human resources and budget capacity. The county manager's office and budget office were able to allocate some funds for a one-time increase to assist us with capacity, but this was not going to, we weren't going to staff up for a large permanent well water testing campaign. And through that, we determined that we really needed to direct well users out to qualified commercial labs as the primary way of getting their well water tested. And lastly, in terms of the impacts on other agencies and jurisdictions, we needed to communicate well to those other agencies and jurisdictions, especially our neighboring counties and officials at the state level, about what we were doing so that when their phones began to ring, they would know where to send people and how to answer those questions. So some additional work on that ultimately coalesced on June 24th of last year. We mailed 19,000 notices out to the addresses of suspected well users in the eastern half of the county. We don't have a centralized database of every well within the county, but we were able to use county property records and other GIS layers to identify those properties that are likely served by private wells and send mailers to them. We made sure that whenever the property address did not match the mailing address, we sent the mailer to both of those addresses because we suspect that's a landlord-tenant situation. And we put this mailer out in both English and Spanish, and it contained all of the information that we were going to be putting on the web, and included information about how to get your well water tested through commercial laboratories, and some information about what the health risk was and why it was important to have well water testing. In addition, we know that once you get that mailer, you're going to have questions, and so we needed to have mechanisms for supporting people and getting answers to those questions. We established a dedicated web page with a simple URL that people could go to. That web page included an interactive online map so that people could type in their address and see if they were in the area where we were recommending these tests. We established a hotline that initially for the first couple of weeks was 24 hours a day, 7 days a week, had operators who could speak both English and Spanish to receive calls. And we, recognizing that we were going to be sending individual well users out to commercial labs to collect well water samples, and there were some sensitive aspects of the sample collection. We produced a video of how to properly collect a sample for radon and water analysis and put that on the website. We also, at the launch of this campaign, held 6 general awareness community meetings. I think we had about 500 people in all attend those general awareness meetings, so that we repeated the message to them face to face and we took their questions. And then, because people have been taking their own water samples to commercial laboratories and getting the results back, and the commercial laboratories are not qualified to provide technical advice about the test results, we made ourselves available at a series of monthly, initially weekly, and then monthly technical advice sessions where well users could walk in with a lab report and sit down with one of our well specialists and have someone walk them through how to read that lab report and what it means for their health risks and how they might go about reducing those risks. Also, since this testing is fairly expensive, a few $100s just for the radiological piece, we made some improvements to an existing program to help lower income residents afford the testing. We have a discount program that allows anyone whose income is less than 2.5 times the federal poverty guideline get reduced fees for testing through the county. And from the launch of this campaign into the fall, we actually prioritized the county services so that we only served the lower income residents, and they did not have to go out to these commercial laboratories and pay full price there. And we streamlined the qualification process for that, so it's a simple notarized affidavit completed by the resident where they attest to their own income level, and we don't require them to submit a lot of W-2s or other documentation in order to qualify for that discount. So we did all this, and there was quite a bit of excitement throughout the county and other people impacted by this campaign. But has it worked? By the numbers, we had a pretty big response. Over 350,000 views of our web pages at the dedicated URL that we set up. We had 1,300 calls to our hotline within the first few weeks, and we were able to do that without disrupting the normal phone numbers that we use for scheduling construction-related inspections and so forth. We received over 70 requests for financial assistance with testing from lower income residents, and we had over 500 people attend those community meetings. Ultimately, we reached out to the private labs and asked them to report to us each week how many samples they received from Wake County residents. We don't have perfect numbers on that, but it looks like an additional 1,200 wells were tested during the height of the campaign over the summer. So 1,200 wells is a far cry from the 19,000 or so that we estimated ought to be tested. But I will note that that is 3 times the number of wells that my staff and I can sample in a given year. So within 3 months, we got 3 years worth of testing done. So that's a pretty big advancement. And just looking again in a semi-quantitative cartoon here, the scope of the problem in 2018 is there on the left. And in 2020, we have moved the needle quite a bit in terms of the number of total wells that have been tested for radionuclides, and a little bit in terms of the wells we have confirmed to be contaminated. But we still think there are a number of a few thousand wells in the county that are likely contaminated and probably have not been tested. So we'll continue to push this issue under sort of more normal steady state conditions. But through this campaign, we've produced a number of advancements in well user support and well water testing. One of these being an improved and streamlined process for the financial assistance with testing. Also with some help from the state of New Hampshire and counterparts in Vermont, and through the US EPA, we were able to implement an online test interpretation tool called Be Well Informed in a version that's customized for Wake County and based on state recommendations specific to North Carolina. And there is a link in this slide. I think Philip is going to make these slides available to anyone who attended today later on, and you'll be able to click on that link and go in and see Wake County's customization of Be Well Informed, but you can also go and compare how New Hampshire, Wyoming, a couple of other states have used that tool to allow users to enter their test results and receive a report that tells them what's wrong with their water, what their health risks are from those problems, and what fixes they might want to consider in order to reduce their risk. Our technical assistance meetings have also been a very helpful and popular forum for getting technical assistance. It's a little more efficient for us than having to talk to each individual for 20 or 30 minutes on the phone and walk them through their results. So we're going to be continuing that as a regular part of our program now into the future. In addition, because of our outreach to stakeholders during the planning of this campaign, we now have much greater awareness about this issue among the various professionals who support well users. Our neighboring county health departments are aware of this issue, and because we had to privatize our response to it, the resources that we've put online have been approachable to their residents as well. We've been doing quite a bit of outreach to home inspectors and realtors so that when people are at the point of a real estate transaction, they're aware that there may be other tests they want to run beyond what the normal VA or FHA loan requires, like coliform and nitrate, but also these radionuclides. We've provided training to water treatment contractors and plumbers in the mitigation of these issues so that the professionals that well users will be going to mitigate these problems are aware of the issue and have received some training in how to do it, what the cautions and caveats are around mitigating these particular contaminants. And we're also making inroads with the medical community, advising them about these things. Our conversations with the medical community during the planning stage showed us that if physicians and ER professionals were thinking about well water at all, they tended to be thinking about fluoride in terms of children's dental health and bacteria in terms of intestinal illness, but they were generally not aware of the prevalence of uranium in well water within Wake County and the potential fairly short-term health risks associated with uranium. In addition, we've made some progress in educating commercial labs about how to serve private well users better. Our conversations with private labs, with one lab during the planning phase of this, indicated that if a private well user approached that lab and wanted testing, they would give that customer a list of all regulated drinking water contaminants and ask them which ones they wanted. We're trying to encourage those labs to use simple shorthand with well users and to adopt the same recommended tests that we have on our website within easily named packages. So when a well user comes in and says, I've never had my well water tested, we tell them they should get their first timers package. And that package includes certain tests. We're encouraging the commercial labs to think in those same terms and include those same recommended tests. Likewise, in terms of the radionuclides, we have something called the RADS package, and it contains those 3 water tests, or it includes those 3 water tests: uranium, gross alpha, radon, and water. But we give it an easy, user-friendly name we're encouraging commercial labs to adopt a similar approach. So what's next? We'll be continuing this push. One thing we found was that low-income residents seem to be responding to the campaign at much lower rates than higher income residents. Overall, it looks like we had about a 7% response rate to our mailers, but low-income residents, that response rate is less than 2% of the estimated population of qualifying households. So through the end of February, we're offering free well water testing for households who qualify at that 2.5 times the federal poverty guideline threshold, which is about $65,000 for a family of 4. We're continuing our training for the supporting professionals, giving presentations to realtors, home inspectors, and also at grand rounds at one of the major hospitals here in the area next month. We are working with those commercial labs to try and get some data summaries. Unfortunately, we're not able to get the results directly from them because that's part of a private business transaction, and their attorneys and our attorneys have both advised us that we shouldn't be trying to get that data directly, but we are asking them to provide us with summaries of what % of the samples that they received exceeded thresholds for these contaminants. And we're currently trying to identify resources to help affected well users. One of the biggest challenges in this is that we can make the testing affordable or even free, but if you cannot afford the testing, then and you need mitigation on your well, you are likely not going to be able to afford the mitigation. We have identified some financial assistance programs to help with that, but there is no silver bullet in this. North Carolina has quite a few programs aimed at protecting private well users from man-made contamination, but naturally occurring contamination is generally not covered by those programs offered by North Carolina, and even through the EPA, like through Superfund. The focus of that is on man-made contamination. And that in particular is an issue we see that we'd like to see taken up statewide, going back to this map of areas of susceptibility to radon in groundwater. The issue we face here and the financial assistance needs for residents of Wake County is not limited to Wake County, but it's likely going to be felt in other places. And we could overlay onto this other maps such as susceptibility to arsenic contamination in other parts of the state, and those well users are going to have similar needs for financial assistance. I have to give credit to a lot of states, and I'm not going to read this slide, don't worry. But when Philip provides this deck of slides, you'll be able to click on the links here and actually go directly to these reports. So we benefited from years worth of work by others in assessing this issue and providing guidance. In particular, I will note again the Radon and Water Advisory Committee report and Ted Campbell's excellent leadership on that. And I'll note also the USGS circular about the quality of water from domestic wells. Again, I think highlights the point that Wake County is not unique in facing these naturally occurring contaminants. This is probably a national issue in general. And then the rest of these are a number of guides to radionuclides, how to protect your well water from them and reduce the levels in your well water. With that, I will turn it over to Philip and open up for questions if we have time. Thank you.
It's great. If you have questions, please feel free to type them in the chat box.
So in case there are people typing, just to make a note, this is Philip again. So I will acknowledge, Evan, I don't know if you knew this or not, but I've been in conversations with Ted Campbell. And certainly there are other people, for example, Rick Wooten from the North Carolina Geological Survey here in Asheville area, about reaching out to those areas that have similar geological formations that are identified there in the advisory report that you referred to. So that is something that's going on. I noticed that someone says they don't see any reports or slides to download. I'll email them out to everybody as well, just in case you're not able to download them from the chat box.
We have 3 different questions now, Philip, so if you want me to go ahead and do that.
Well, go ahead, please.
Okay. Is there a direct indicator between uranium and gross alpha?
So there is a relationship. Uranium is an emitter of gross alpha activity, and let me see that the EPA's Small Entity Compliance Guide for the Radionuclides Rule provides some useful strategies for interpreting gross alpha. Initially, we implemented our testing recommendations just using gross alpha and radon in water, but we found that because radium-226 is also a contributor to gross alpha, well users were having to come back for follow-up testing to determine specifically how much uranium was contributing to their gross alpha and how much was radium. So we felt like running the uranium and the gross alpha together was an effective way of finding out how much uranium was contributing and getting an approximation of the radium. It's not a perfect way of measuring radium, but the radium test itself is quite expensive compared to all the others, and we felt like providing a low barrier to entry was important for this testing. In our testing, it looks like uranium is the primary contributor to our gross alpha readings, but different areas with different geology might have more prevalence of radium, and so specific radium testing might be more important there. I would point out like New Jersey's requirements for point of sale testing of wells. They actually have different recommendations for the radionuclides or different requirements for the radionuclide testing depending on which county you're in, because there's different ratios of uranium and radium.
Okay, here's another. What are some of the recommended water treatment choices at a low cost?
Well, it really depends on the specific mix of radionuclides in your well water and other what we call confounders like iron, manganese, and hardness. If your problem is with mineral radionuclides, then reverse osmosis is a fairly low cost system because you can install that just in the kitchen and treat the water there. But if you have radon in your water at levels that needs to be treated, then you're going to have to go with a whole house solution, and that's going to increase the cost quite a bit. And we really can't point to a recommended water treatment choice until each person has their specific test results.
Should individuals in low, moderate areas be concerned about testing their water wells or their well water?
I'm going to assume that that's referring to the susceptibility map.
Yes.
In terms of, in Wake County, we have included that moderate susceptibility area in our testing recommendations, and so
okay.
Take that for what it's worth.
All right. What is your recommended retest frequency?
That's an excellent question. From what we have seen, most of the testing for radionuclides in private wells has been one time, or the testing that's been published has been from one-time campaigns, and we haven't seen a lot of repeat testing to tell us what the interval is and how much variability you see over a year or more. Generally, I think we would suggest that people who are in the recommendation area may want to retest every year or 2 years. If you get clean results, then maybe you retest in 2 years to make sure there's not been any changes. But there's not a lot of real solid guidance out there yet.
Okay. Have you seen in the RADS package any evidence that supports the EPA's outdated information that 10,000 picocuries per liter in water generates 1 picocurie per liter of radon in air?
It's a little bit of a loaded question, but we don't. So the radon in air testing that we make available to well users actually becomes a transaction between them and the testing company. We drop off a kit, they mail it off, and we generally don't see the results of that. There is this rule of thumb out there about 10,000 picocuries per liter of radon in water correlates to 1 picocurie per liter in air, but that's really going to depend on how the occupants of that home use water in that home. If they take long hot showers, it's going to be different than if they take very short showers, just to cite one behavior that's highly variable.
Okay. Can you discuss the 4,000 and 10,000 picocuries per liter threshold that you mentioned in a little bit more detail? And is well water remediation recommended at the 4,000 level or the 10,000? And somebody else has said that they use 2,000 as the recommended action level.
Yeah. So we're trying to follow the advice from the Radon and Water Advisory Committee that North Carolina convened several years ago. Their recommendation was that at levels between 4,000 and 10,000, well users may want to consider treatment of that water in conjunction with dealing with an overall indoor air problem, and that at 10,000 or higher, treatment was recommended, again, in conjunction with the overall indoor air issue. It's a little bit gray, but I think essentially it's a much stronger recommendation to treat above 10,000 and sort of a advisory to consider it between 4,000 and 10,000.
Let's see. Assuming that treatment is installed, what ongoing testing strategy is suggested to confirm that the treatment is really working?
So number one thing we would say is to follow the treatment installer's recommendations for retesting, but definitely get a confirmation test once the system is installed. We have seen a number of systems go in that were partially effective but did not achieve the outcomes that we would like to see, or that even the installer was expecting to see. So you want to get those issues worked out right away after installation. And then after that, it's really going to depend on the particular system that's installed and what the lifespan of the media and other components of that system is, how frequently you'll want to retest it.
Okay. And then we've got two more, and then I think we'll probably break it off, and any other questions we can try to answer via email. But how was the 1,000 picocuries per liter action level established?
So I think this is maybe is referring to the 10,000 picocuries.
I think they maybe, yeah, perhaps they just missed a zero there.
I'd really have to point you to that Radon and Water Advisory Committee report. That team looked at a lot of studies, including the National Research Council report on radon and water, and took a lot of information into account in coming up with that. So rather than try to summarize all that here, I would point you back to that.
Okay, and just as a follow-up, what are the dangers of drinking contaminated water?
Well, again, depends on the contaminant that you've got present, but in terms of radionuclides, many of these things are associated with an increased risk of cancer from chronic exposure, so repeated exposure over a long period of time. But as we understand it from reading information, the tox guide for uranium, the shorter term risk with uranium is reversible kidney toxicity from uranium's behavior as a heavy metal.
Okay. And then I guess there's one more question, and then this will be it, and then we'll let Philip just sort of wrap it up. But would it be possible to have well water reading that's at 10,000 picocuries per liter or above, and yet have the indoor air reading be below the action level of 4?
Right.
And if so, would water treatment be recommended?
I think it's highly possible to have that happen. And yeah, generally we think people should look at the cost of remediation of water versus the cost of remediation of a soil vapor issue, and choose the one that provides the greatest overall radon reduction for the least cost. And in that situation, I can't speculate on a particular situation, but.
Philip, do you want to sort of wrap it up and tell them what you've shared and talk about the one on February the 6th that will go into more depth about water as well?
Yes, thank you, Sarah. And Evan, thank you again so much for sharing your expertise, your experiences. I think this is going to be significant wake up for some folks in other areas of the country, but also the experience that you shared and the process that you've been dealing with this is, I believe, spot on, and I'm thankful that you're being willing to share that. With regard to some of the questions, I don't know if everyone is able to download or know how to download those things that I've uploaded to the chat box. But what is happening on February the 6th, and that's the next webinar in the February series, and that is Jay Hyland from the state of Maine's radon program. They've been actually addressing radon and radionuclides in well water for a few decades. So they're actually going to share what are some of the treatment systems for radionuclides and radon in water. So the details will come out in that. The radionuclide fact sheet, someone asked about health impacts. So I've uploaded that. That is from the Division of Public Health in North Carolina. So you'll be able to see those health impacts in that fact sheet. And then there is, there's a number of other things. So, and hopefully you've also received Evan's slides, so you'll be able to link to those resources that he has referred you to. If not, email me and I'll email it out to you. There are folks asking in questions about personal homes, so forth. Feel free to give me a call and I will help you with that process. So again, Sarah, Evan, thank you so much. Thank you everybody for participating, and hopefully I'll see you all in the February workshops or webinars.
Thank you.
Thanks, Phil.